we are. This is Dr. O and the Dr. O Show with a adhesive capsulitis, frozen shoulder. Vanessa and her husband Gary have flown up from the United Kingdom to Estonia to have her shoulder fixed using the OAT, non-surgical operation, manual capsular dissection procedure for frozen shoulder recovery of adhesive capsulitis frozen shoulder, which is the worst kind of frozen shoulder. One that, if you're watching this video, you're probably already very familiar with. So Vanessa's here. We can see her smiling face. She's given over control now to me and all the worry. She's just passed it over to me now because she's been pretty concerned, as you probably are if you've got frozen shoulder, and pretty apprehensive. But if you want to tell us about your journey here and maybe how you found us, and then all of the trepidations that you had and concerns that you and both your husband had, and how you finally got here.
Okay, we searched the internet, that's how we found you, and we watched your videos on there, and we made lots of inquiries about you, found out that you had 3 clinics, and Estonia was the closest one for us coming from United Kingdom. We made contact. After I've gone through chiropractic at home, I've done osteopathy, I've had physio, and nothing helps. So, and I spoke to somebody in your clinic a couple of weeks ago that put my mind at rest, and since I've spoken to her at home.
This was one of the patients that had come. Where did she come from?
She came from Liverpool.
She came from Liverpool, from the UK as well. And she happened to be in the clinic at the time when you called, when Gary called, and her husband called, and I said, well, as a matter of fact, there's a patient from the UK here right now. Do you want to talk to her? And then you said, well, have her give me a call later. And then she wouldn't be under the gun. You knew that you were getting the true goods, right? It wouldn't be just in front of me. You know, anyway, let's get a real private conversation going. So what did she tell you? And who was that patient?
Her name was Anne,
that's
from
right.
Liverpool. And she spoke to me, I think it must have been only a few hours afterwards. And she said, yes, nothing to worry about, go for it, the best thing she ever done. And she said, nothing to worry about, so here we are. I've spoken to her since as well, so she's made a good recovery. She said, go for it.
Yeah, great. So you're here.
I'm here.
All right, let's see what you can and can't do now with the shoulder. Let's show the right arm, which is the one that's not affected. Keep the hand pointed that way, in that direction, the other direction. Yeah, that way and up to your head. Good. Now, without letting it come forward at all, keeping it in line with your side or even almost in line with your buttock, bring up the other one and don't let your shoulder, keep that one up, and don't let the shoulder tilt at all. That's as far as it goes, okay? And now what I want you to do is put your arms down by your side, this way with your elbows there, and put both arms out. And that's as far as that one goes. Okay, let's see with your arms up this way. That just doesn't even get up at all, right? Okay. All right, and let's see behind your back, as if you're going to do up your bra, both arms up. Wow, you're flexible. Can you believe that? Huh?
We've had 8
Well,
months of this.
He's
8
wiping his
eight
eyes
months
there.
of this. I tell you.
Huh? Yeah.
8 months of that.
And
It's
you've been
amazing.
in all kinds of dogs and therapists, and nobody's been able to do this.
Nobody's
What
been
we
able
just
to
did
do
in about
anything.
1 minute or 2 minutes.
No.
Is that hard to believe? Almost.
Absolutely.
Yeah.
Yeah.
So we're going to gradually take it a little farther back and forth. This will be a little bit of a dicey area right here. Take it back again. And we're going to move through this range again afterwards. See, just more and more relaxed now. So continue to breathe in and out. And as you breathe out, your body relaxes. And you let everything go. Breathe, relax. Down. Okay. Now she goes. So you'll see how fast the brain changes. Look at this. See it? See, she couldn't do that at all like a minute ago. The brain changes very quickly. Hold it up. Hold it up. See? See how fast? That's how quickly it changes. Yeah, and slowly. That's how fast it changes. So this will be a good recovery if she keeps working like this. It's very nice. See that? There you go. You're going to switch your hands over so they're backwards now. There you go. Now it's going to be a little more difficult to do it. This is your next level, okay? Come back here. It's going to be a little more difficult to do now, okay? Okay, go ahead and raise it up now. You've got the shoulder joint rotated and flexing at the same time now. Keep going. You got to touch that wall. Come on. Wow. Wow.
I couldn't do that.
Wow. 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 That looks good. I mean, that's looking good. So here we are, day 2. Vanessa and Gary have been up all night working and doing the specific, very specific exercises that they need to be doing post-operative OAT, which we did last night, and less than I guess 15 hours ago. And we're going to see right now how they've made out with all their exercises and how well that arm is moving today. So keep going, keep going, keep going, keep going, keep going, keep going, keep going. You see? See? She moved into that range by herself. She didn't have to reach down. You see the difference? You see that? Right? Now put the fingers together and really reach up. Really, that's it. And reach up and straighten the elbows. Beautiful. Beautiful. You see how it helped? The trigenics sort of triggered all of those mechanisms and finally she was able to move into that range.